The GP has referred a patient to hospital for inpatient admission. We will now pre-admit and reserve a bed for the patient. Click and open the Pre-Admit List tab. Click on the arrow on the PM conversation icon. Click on Inpatient Non-Elective Pre Admission. Enter the patient information into the left search panel of surname, gender and date of birth as a minimum. Click Search. Note the PDS search button is currently unavailable until a local search is performed, and will not be available if you are not logged on with a smart card. Complete details. Click Search. If there are any details on the local EPR system for the patient, they will be displayed on the main screen. As you have used the surname, gender and date of birth to search for the patient, the PDS search button is now available. Click the PDS search button to begin synchronizing the local patient record with the PDS record on the spine database. Note, if you are not using a smart card, you will not be able to perform a PDS search. Failure to use a smart card will result in locked demographic records which will subsequently prevent PDS spine updates. Patient appointments letter being generated and sent to patients, and the display of patient demographic details on clinical documentation. Before reviewing the patient details on the spine, a pop-up message may appear making you aware that your activity will be audited. Click in the tick box to ensure that this message will not appear for the next 28 days and then click the Accept button to close the window. If the patient is located on the PDS, the results of the PDS search will then display any patients that match your search details. Verify the patient details, and then click on the patient line to highlight it, and click the Select button. For some patients, there may be a mismatch between the details that are kept on the local EPR system, and the details that are kept on the National Spine Database PDS. Review the data in each yellow section, and click the circular radio button to confirm whether the local data or the PDS data is correct. Once this has been done, click the Update button at the bottom of the screen. Search the patient details and click Add Encounter. The Inpatient Non-Elective Pre Admission window opens. Complete the mandatory fields, those in yellow, and click OK to complete the conversation. Click OK. Click OK. The patient will now be on the pre-admit list with destination ward mentioned in the details for bed management to action further. The bed management team will reserve the bed for the patient by dragging the patient record from the pre-admit list and dropping onto the bed. The reserved bed will be shaded to show the reservation, and the pre-admit list destination column will have the ward and bed details.